Assessment 3, Effective Care Plan for a Person Experiencing Mental Ill Health. Anxiety, mood and substance abuse disorders combined account for over 25% of mental illnesses, and diverse or marginalised communities have the highest rates. This presentation will detail a specific case study focused on Maya, a 15-year-old LGBTQIA person with severe anxiety impacting her daily function, causing a high burden of disease, and diagnosed as generalised anxiety disorder. Targeted at an audience of professional adolescent mental health care workers, learning outcomes to confidently recognise, assess and implement a specific care plan to orientate a recovery-based outcome for that individual. Generalised anxiety disorder is a condition where the patient is overly concerned and worried about general daily processes, often with head and stomach aches, and the condition is symptomatic for at least 6 months for a diagnosis. Maya's general anxiety is characterised by a feeling of constant dread and an uneasy internalised feeling that has been identified as a link with a perception of uncontrollability and even unpredictability about events, both occurring at the moment and for future events. Whilst not all anxious feelings are unnecessary, feeling nervous about a school performance or speaking in public, Maya has these feelings throughout the day, in general situations like walking to class, eating lunch, or playing in a playground or completing a work task. Approximately 30% of all adolescents will experience anxiety or a depressive disorder. Puberty is a compounding factor, and in 2021 there was a link with breast tissue development and depression and anxiety with Latino and Asian communities. LGBTQ plus communities have higher rates of suicidal thoughts, nationally 75%, with a third, 30%, reporting a suicide attempt in their lifetime. The burden of disease affects every aspect of Maya's daily life, affecting her concentration and output at school, social interactions and sleeping at night. There are a number of services that are specifically tailored for individual groups to provide counselling and advice, interactive apps and regular check-ins. Services are ethical and legal by focusing on individuals and providing support without increasing trauma. Lifeline, Black Dog Institute, 13 Yarn, Beyond Blue Headspace, there's recovery-orientated practice is the centre of all supports, investing in focusing on strengths and measuring outcomes, listening to clients, and involving family and community supports for long-term and sustainable results. Pharmacological treatments are effective for the management of symptomatic presentation of anxiety and depression. They have proven to potentially increase suicidal ideation in young adults under 25 years old. A study covering a period of 2016 to 2022, dispensing rates of pharmaceuticals increased by 66.3% per month per child, adolescent and young adults. Selecting the right medication takes time for a biological effect to begin and needs to be accommodated in plans for a realistic time frame to measure a response. Non-pharmaceutical areas include counselling, specific concerns, and using tools for measured outcomes. CBT, or cognitive behavioural therapy, to rewire through the process of rewiring essentially negative brain thoughts consistently to try to consistently think differently in a more positive and beneficial state. There are a slew of therapies that have been useful in treating a range of mental health conditions, from hypnosis, art, equine water, sound and music therapy. This is a busy slide. This is the assessment process. So you would be looking at assessing adolescents' mental health guided by their legal right for confidential care. The holistic approach develops a study looking at presenting issues, predisposing factors, precipitating factors, perpetuating factors and protective strengths. Key drivers and assessment considerations are confidentiality at school, basing the case on what's happening there with bullying, traumatic events, cultural events, attendance, homework. A HEADS assessment is a 8-question measurable to build rapport, and then looking at there's 4 other tools that would be used the GAD-7 is looking at generalised anxiety disorder, and the DAS-10 is the depression anxiety stress scale. The Kessler-10 is the psychological distress scale, and the ACEs, or adverse childhood experience questionnaire. All of these would be performed. Maya lives at home with her parents and younger brother. Her parents are very concerned as a teacher has noticed her changes and has asked what's happening at home. Maya presented with feelings of worry, disrupted sleep, and need for constant reassurance, fatigue, and as an LGBTQIA person felt misunderstood and targeted. These all impacted her daily functioning. Her symptoms coincided with puberty, and she doesn't sleep well. She wakes during the night, says she cannot switch her brain off, that she's constantly thinking about possible scenarios about, future events that haven't happened yet. Families are vulnerable to stress and could develop health issues themselves by, not knowing how to support Maya, so education is key. Her strengths are that she has a good support network and strong communication skills, and that she's very confident in her choice as a person, as an LGBT community member. So at school, being that person, she does sometimes feel harassed and bullied, and as a result, she feels stigmatized and sometimes feels shame. So she is consistently seeking reassurance about expectations and around actions and activities, perfectionism, disruption to sleep, fatigue, displaying irritability without due cause, restlessness and difficulty focusing due to ruminating over unjustified worries. They're her weaknesses. Okay, based on the results of Maya's assessment, initiating an anxiety medication would be appropriate, something like an SSRI like Zoloft, which is indicated for GAD in adolescents, starting at 50 milligrams, and then reviewing her tolerance and benefits in a fortnightly schedule. Maya should start a daily medication journal for her side effects and improvements. Non-pharmaceutical action would involve regular counselling and cognitive behavioural therapy. The role of her friends and family, that they would support her to stay on her care plan, and that it's important for her to have friends who are willing to hear her challenges and to support, so that they're to sort of minimise any negative consequences due to misunderstanding. Providing feedback for her practitioners and giving observation reports in a broader and rounded assessment over time. Committing to attendance every 2 weeks would be important, and again looking at those tools, the assessment tools, the DAS-10, to look for improvements. Measuring the outcomes of the person's progress, again looking at psychoeducation and discussing self-reflection with anecdotal symptomatic management. Looking at the K10 and DAS-10 recordings over time. These tools can look at changes and making sure everything's working in the right direction. Fortnightly counselling session and monthly CBT. Maya's family targeting outcome and anecdotal documenting progress to encourage continuation. The structure of the case plan is a recovery-based orientated focus in a stepwise mode to make informed decisions about investigations that can be measured for success and revised over time. Maya's general anxiety is symptomatic with her worry, sleep issues and social concern, and the recovery plan is the fortnightly counselling with family nominated friends being aware of the plan to try to reduce triggering, teachers to address outlined concern with bullying and harassment, and psychoeducation counselling support for family and friends. The justification for treating Maya's generalised anxiety disorder is to reduce her symptoms so that she can minimise them and adopt learning strategies to maintain long-term relief and sustainable control. Attending counselling for specific discussion and treatment around anxiety to target concerns causing sleep disturbance on a fortnightly basis is a maintainable schedule and would be reviewed every 6 months. And again, looking at those measurable tools. CBT treatment would be a monthly process, and the treatments are designed to reduce the sleep disturbances, and her symptomology will be reviewed ongoing and reviewed every 6 weeks. Maya's personal recovery plan, again looking at anxiety, sleep and social concerns. The recovery process is looking at things holistically and based over time, measuring her symptomatic reduction in the plan. Family members would be psychoeducated and counselled along this thought process. Critical reflection. I'm a practical learner and would have liked to have had gone through working examples of the assessment tools, perhaps spend a day in field, learning from adolescent support units, That said, I have found the course structure with the extensive research papers, videos and recordings and office hour sessions, discussions in support of these assignments to be the foundation of my learning. My learning and comprehension from the university supplied readings and from my own research into all of the relevant topics, especially the assessment tools, are both insightful and have provided me with the knowledge I've needed to confidently produce this work. Thank you.